Are you dealing with an aching or sharp pain that runs from your ankle down into the arch of your foot? Well, it's most likely posterior tibial tendonitis. And as a chiropractor for over 20 years and performing over 100,000 adjustments, in this video, we're going to explain what exactly is happening to you, why your shoes might actually be making it worse, and the 3-step protocol you need to get relief. So why am I having posterior tibial tendonitis? Try saying that 3 times fast. Anyway, the reason you're having this problem is simply because the fact that when you're actually start walking more, or if you're running more, this tendon starts to get used a lot more. And the problem is it starts to get irritated. And the other issue that can happen too is if you're actually going from running outside to running on a treadmill, or if you're running on a treadmill and then start running outside or walking outside, then it starts to change the way that you walk and the way that your foot actually strikes the surface. When that happens, that can irritate that tendon, and that tendon becomes inflamed. When it becomes inflamed, then the nerve endings start to give off the pain signal, and that's why it hurts to walk or it hurts to move. But there's another reason why this could be happening. It could actually also be from your shoes. You see, for a lot of us, when we actually look at our shoes, we look at the back ends, we can actually see that there's an area where there's an uneven wearing of that shoe. For me, both of my feet are pronated out a little bit from years of spraining my ankle or wrestling, different things like that. What happens is that wears on this part of the shoe more, and over time, that shoe becomes more worn down. My foot then is going to step like this more. So that when I strike with my heel, I'm not striking with this part here, I'm actually striking more right here, and that then starts to wear more. As it continues to wear it down, that gives me less support in that area, and it makes the problem worse. This can lead to actually spraining your ankle easier. Or the other issue is too, is it starts to cause your foot to strike differently, and that can lead to more posterior tibial tendonitis. So how do we fix it? Well, we've got a 3-step protocol that we're going to do today that's actually going to help you to get over this pain so that you can actually have some relief and get back to doing the activities that you want to do. So the first step of our protocol is massage. We're going to massage this tendon all the way down right into here. To do this, what we're going to do, we're going to take a little bit of some lotion, or if you got some oil or something that's going to cause a little less friction. And we're going to take our thumbs, we're going to go here, and we're just going to kind of press down along this bone right here. And what you're going to feel first is you're going to feel the ridge right here of your tibial. Then we're going to take that and we're going to work down here behind the ankle, coming like this and working right through here. We're going to come through, and we're just going to rub that area just like this. And you might feel a little bit more tenderness right here along the bone where the skin's a little thinner. There's a little less muscle tissue, and that's normal. But you're going to work through here and working your thumbs into that arch. But as you're working it, you're coming through here, and you're going to come back up, back this way. I always like to go down first, just like this, and then kind of come back up, kind of get that lymphatic movement a little bit better up, right through here. You can take both thumbs and just kind of work that down like that. Or you can take one thumb on top of another and support it to give you a little bit more pressure if that's what you need. Now, if you don't feel like you're getting enough pressure, or this doesn't seem like it's being as effective as you want, you can also take the end of a knife, and I don't mean this end right here, the sharp end, I mean the blunt end here of a butter knife. And you can actually work it down through that tendon, just kind of working all the way through. And as you do this, this will kind of dig a little bit deeper and get you a little bit more into that area that helps break apart that scar tissue. It actually helps so that you're actually healing that tendon more. When you're doing this, you're going to want to do this for about 3 to 5 minutes at the most. Okay. And you want to make sure that you're never causing bruising. You never want to be pushing so hard that it's tearing the skin or anything like that. If you're older, you definitely want to go with a little bit lighter touch, especially if you're any kind of blood thinners or anything like that. But you're going to be working that knife just kind of along, come through here, and just kind of work through here. Again, that's if you feel like you're not getting in deep enough with your thumbs. I would recommend starting with your thumbs, then going with the blunt end of the knife right here, and just kind of working that down right through there. Doing that for about 3 to 5 minutes, going back and forth all through there, just like that. The next thing that we're going to want to do for our protocol is stretch. So we're going to be doing 2 different stretches. First stretch, we're going to be using stairs at home. So I'm going to use this right here, a little step up, but I'm going to come up here just like this. I'm going to have the stairs, and I'm going to take my foot, putting my foot pad right on the end of the stair here, and I'm going to stretch down with a 45-degree angle going just like this. What that's going to do is isolate that muscle more. And not only are you going to stretch the gastroc, which is part of your calf, but you're also going to be stretching that tendon more. Things that you need to remember. When you're stretching, you always want to make sure that you're never stretching into pain. It should never hurt to stretch. If you're stretching into pain, then you can be causing more harm than good. So remember, you always want to go into a deep stretch or a good stretch, but never go stretching into pain. So you're going to take that again. You're going to be here, turning your foot just like this, off the stair, and going and stretching just like that. As you do this, and as you're stretching, you're going to want to make sure that you're stretching for about 20 seconds, and you're going to do that about 3 to 5 times. If you can handle only 3 at first, then build your way up to 5. The next stretch we want to do is actually going to be a little bit easier. You're just going to come to a wall. You're going to kind of put your foot behind you, okay? And you're going to bend that knee, get that stretch. Now, a way to get more stretch on that tendon right here is you come back like this here, and you stretch, bringing this knee towards the wall, and you've got your foot angled again at about a 45, and that will stretch that area more. In doing so, again, you're going to hold this for about 20 seconds or a 20 count, and you're going to do it 3 to 5 times. For me, I don't get as good of a stretch doing it this way. I prefer it with the stairs, but for other people that might have balance issues or they don't feel comfortable doing it on the stairs, doing it against the wall might be a little bit easier for you. Both stretches are great, and both should be done, again, 3 to 5 times. You know, a lot of our aches and pains can be relieved simply by stretching a little bit every day. If you'd like a free at-home stretch guide that takes about 10 minutes, then click on the link in the description below. Now that we've actually done some stretching for some relief in the area, the next thing we want to do is we want to strengthen the area. So what we're going to be doing is we're actually going to be taking a band, we're going to be putting it around our foot, putting the band on something that's stable, and we're going to take our foot in this position here, and we're going to bring it down like that. So we're going to start going from up and away, down into the middle. So up and away, down and towards. Up and away, down and towards. Again, going just like that right through there. Now, if you want to feel a little bit more stable, then you can put your foot on the ground right here. When you're doing this, you want to make sure that your knee is straight ahead. But you're going from here, down like that. Here, down. You're going to do this 10 to 15 times to start off with. Normally starting off 10 to 12, 3 sets, but work your way up to 15, and if you can work your way up to 20, that's going to be even better. The next exercise that we're going to do is simply balancing on the foot. Now, you want to make sure that your shoes don't have any wear and tear on them. You want to do this with a good pair of shoes. So if you have any kind of like part that's been rubbed off, like we talked about earlier before, you probably want to get a newer pair. To do this, what you're going to do is you're going to put your body weight on the one foot, and you're just going to hold it there for 60 seconds. And you're going to do this 3 times. As we're holding this here, what you're going to want to make sure is maintaining your balance, because this muscle is very much involved with the balance of your foot, which then controls the balance of your body. So you want to hold this here for about 60 seconds. As you're doing that, if you find yourself wavering or you need to put something behind or by your side just to sit there and help with your balance, that's fine. But you want to be able to do this free-handed, just kind of holding it for about 60 seconds 3 times, maybe build up to 5. If you're already able to do this without any problems, then ways that you can actually strengthen this is actually leaning out and holding that foot just like that with your arms out in front, or you can go back just right there, and that will work that just as well, holding each of those. If you get up to the point where you're doing this 3 to 5 times for 60 seconds, then you've got it done. But if you want to make this harder on you because you feel like it's already easy enough to balance on your foot, then you're going to work on putting your arms out, putting all your weight on that foot right there, and going forward and holding that for about 30 seconds, and then coming back like this right here, putting all that weight more on that heel and balancing that way for 30 seconds. Doing that 3 times, working your way up to 5. You're going to want to make sure that you take a break in between each one, just because of the fact that you let the muscle relax and rest, and you don't want to actually stress the muscle too much, because then it's become more inflamed. More exercises and tips to feel your best, click on that subscribe button. And if you'd like to set up a free consultation with Triple Crown Chiropractic, then click on the link in the description below. I'm Dr. Erik, aka the Kentucky Chiro, and I'll talk to you soon.